Hello everyone, Eric Zalowski here again, and thank you for making it to our fourth and final Pharmacy Day at the Capitol pre-event webinar. Sorry for the delay in posting the last webinar. We are grateful to have received a huge response in the call to advocate for pharmacy. On September 22nd, you will be joining MPA and almost 400 other student pharmacists in making sure your voices are heard by legislators. This is a record-breaking number. Way to go in being active yourself and encouraging others to do so as well. Registration is closed and we are at capacity. If you know of someone else who is interested, there will be many other opportunities throughout the year to advocate for pharmacy, and Pharmacy Day at the Capitol is an annual event. We strongly encourage everyone to sign up early again next year, as coordinating 400 volunteers does require some logistical planning. The larger than expected number has also required us to make some minor changes that are addressed in this presentation. As of September 15th, today, the weather forecast for Pharmacy Day at the Capitol looks promising. It's unlikely that we will have rain or inclement weather, but be sure to check the forecast as the weather gets closer. You might still want to bring an umbrella in case the weather doesn't cooperate. Here's a look at our updated schedule. Wayne and Michigan students are to arrive at the church first for greeting and orientation, and then head over to the Capitol. At 9:30, Ferris students will also get organized at the church and head over for the picture on the Capitol steps at 10 a.m. Following the picture, we will break into our block assignments for volunteer activities, lunch, tent breakdown, and debriefing. You should expect to be done by 2:15. This is the new block schedule for this year. It might be difficult to see all the details if you are viewing this presentation on a projector. However, the schedule is a little bit more complicated than previous years. Your block assignment and schedule of the day will be emailed to you before the event. Your block assignment will also be printed on your name tag, which you will receive during our welcome and orientation. Your group will also have student leaders who know where you will need to be and when. Of course, staying with your group gives you the benefit of having an organized and varied experience. However, the biggest reason you might want to stay with your group is lunch. If you're not with your assigned group, you may skew the numbers enough that you or even someone else at the location does not get lunch. We will definitely do everything possible to prevent that. However, if you stay with your group, you will get fed. And we have upgraded sandwiches this year. For medication disposal, there will be two locations. One will be for curbside drop-off, and the other will be in the tent. Students will be sorting out returned or expired medications. Be sure to maintain patient privacy regarding health information at all times. If you are stationed in the medication disposal tent, you will be receiving the medications and collecting information regarding the drug name, if it's brand or generic, where it came from, if it's a controlled drug, what schedule is it, and the estimated quantity. This is why you need to bring pens. You will be completing forms that will be run over to the Carew building where other students will be recording and entering the data electronically. P3 and P4 students will be separating the controlled from the non-controlled medications. There are also opportunities to provide poison prevention and medication safety information. In the Pharmacy Skills and Services tent, there will be health screenings, immunizations, rapid diagnostic or point-of-care testing, compounding, emergency preparedness, and pharmacy technician booths. Students will have activities at their assigned tables. They will greet and walk legislators and their staff around the tent, as well as answer any questions about pharmacy and pharmacist education. Pharmacists will be supervising students and may also have to educate and or answer questions from legislators regarding the profession of pharmacy. There will be several immunizations provided in the tent. However, only sponsor employees will be able to administer vaccines due to collaborative practice agreements. Your student group assignment will dictate which workshops you will be attending. First-time students will have an introduction to MPA and will spend time at MPA headquarters. There will be a workshop regarding pharmacists for provider status and how to get involved with the current push for provider status. There will also be a debate workshop that will cover topics either being considered currently or may show up in the near future in Michigan. You will read and debate positions on topics such as a new Good Samaritan bill regarding opiate overdose, biosimilar interchange, a pharmacist-prescribed contraceptive bill that recently passed in California and Oregon, and pharmacy audit reform legislation. Students going to legislators' offices will need to review the script provided in the packets before heading out. Most likely you will be talking to the legislator staff as they will be in session that day. The script will also be sent before the event. Be sure to introduce yourself and tell them that you are a pharmacist or student pharmacist like we talked about earlier. Finally, keep an eye out for new legislative videos in development on the MPA website. They will cover a variety of subjects including the legislative process, how PACs work, how to communicate and write to legislators, and the explanation of current healthcare and pharmacy-related bills. Again, if you have any questions or concerns, feel free to contact either Eric Roth or myself, Eric Sadlowski. Thank you for completing the webinar series, and we look forward to seeing you on the 22nd. Thanks.